Hi, Ronnie.
Hi.
How you doing?
Good. I'm cool, man.
Oh, that's good, man. Can I speak to you about something? You know, mind?
Sure.
Okay, man. You know, it's just that, I wake up, when you're sleeping and you wake up and I do it 4 times and that, for peeing and that. And I mean, gosh, you wouldn't believe the dribbles and all that, man. And when I must go back to my wife, it's like nothing happening.
It's why? Listen, my friend had the same problem. And he didn't go for the checkup. He put it off. So the problem just got worse and worse. And eventually I had to have the checkup. And the doctor asked him some questions and examined him. So it really wasn't that bad.
Examine? What they do?
The doctor did the finger test.
Yo, you serious?
Yeah.
No ways, man. Not for me, man, brother. It's like, yo.
Look, it's nothing to worry about, man. And you don't have to be embarrassed. The doctor's going to explain to you what he has to do and why he has to do it. And the main thing, you have to go for the test. It's very, very important. And look, I went for it myself, and I'm glad I did, because now I know exactly what's happening down there.
Bro, I'm freaked out.
Look, it's like your car, okay? If you want the engine to run lekker, you've got to have it checked regularly.
Bro, I'm scared.
I'll go with you.
You sure?
Yeah, sure.
Cool, man.
Okay.
Mr. Daniels?
Good morning, doctor.
Good morning. Come inside, please.
Thank you.
I'll be waiting.
Okay, thanks, eh?
Okay.
So, Mr. Daniels, how have you been?
Not so good, man. Gone to the toilet a few times and peeing at night, and it's also like kind of 3-4 times.
Oh, tell me, is there any pain when you pee?
Yes.
And have you noticed blood
No.
in your pee?
Not at all. Not at all.
Not at all.
Mm-mm.
Okay, so that's maybe not too bad. I have to ask you this: how is it when you are with the missus?
Oh, you wouldn't believe it. Not good at all. No, it's not. She's not happy. No, not at all.
Okay. Okay, Mr. Daniels, just one more question. Is there anybody in your family that has suffered from prostate cancer? Father, brothers, uncles?
Not that I know of. Not that I know of, not at all.
Okay.
I don't really.
Alright, so look, since you're in your 50s already, it is best if we do an examination. So we're going to just have a look. But first, before we do that, I'd like to explain to you how the prostate works, so that you have a better understanding of what we're going to do. This is what we're talking about, Mr. Daniels. If you look at this picture, you will see that is your penis. Here are your testicles. That over there is your bladder, and right underneath the bladder, you will find your prostate gland. And behind the prostate gland, this is your rectum, or as we commonly call it, your backside. Now, in your testicles, you will find that fluid is produced, and that fluid is carried right through this blue tube back into the prostate gland. In the prostate gland, the semen is produced, so the fluid gets mixed with the semen and then is carried out through the penis. The other function of the prostate is that when urine fills the bladder, the urine runs through the prostate and then obviously out through the penis. From here, you will see that when cancer develops, it develops in the prostate. And if you would like to have a look at this picture over there, that little yellow spot, that is actually the cancer in the early development stages. If nothing is done at this stage, if it is not detected, it can actually go further. If you look at this picture over here, that the cancer has now spread throughout most of the prostate gland. What actually happens here, Mr. Daniels, is that the more the cancer grows, it actually sort of chokes off the tube that will take your semen and your urine out towards your penis, and it applies pressure on here, and that is why you have difficulty peeing, and that is why when you ejaculate you actually find that there is pain. Okay, so that will explain why you have this dribbling and you have to get up so many times during the night. What we'll have to do, Mr. Daniel, since you are over 50 years of age, the best thing we'll have to do is we'll have to just do an examination. And this is what the examination is all about. And this test is called the digital rectal exam or the finger test. I'm going to put on a glove, and then what we do is we just put our finger into your rectum or through your backside, and the purpose for that is to just examine the prostate gland. We need to find out whether there's any unevenness, whether there's any growth, whether there's any swelling here, and once we have determined that, we will be able to take the matter further and we'll be able to manage whatever problem there may be. Okay, Mr. Daniels, I'm sure you have a much better understanding of your situation now.
I do. I fully understand it, and now I know how it works. Thank you.
You're welcome.
See, it really wasn't that bad.
Yeah, you're right there. I'm so glad I did it.
So it's not just about the test, eh?
No, it's not. You know, now I'm gonna give up smoking now. I'm gonna be, be more active. I wanna look after my health.
Yeah.
So you can run like that?
Yeah, like a run, But now that I've had the test, I'm trying to eat more healthy as well.
Now I feel like a real man.
Yeah.
I know how it works. Now my prostate works, so I feel good. Thanks, I appreciate it.
No props.